The main thing with diet is sodium in the diet. If there's a lot of salt or sodium in the diet, and if people eat a lot and they gain weight or become obese as a result of that, that also increases the risk of high blood pressure. If people are not eating enough fruits and vegetables and they're eating the wrong foods overall, like eating a lot of fast foods which are high in sodium, or processed foods, like sausages and bacon and the rest of them, that also increases the risk of high blood pressure and everything else that comes with it. One of the myths that I've heard about in the Black community regarding heart health is patients telling me, when their blood pressure is elevated, they say, but I feel fine. And I know when my blood pressure is elevated. Well, that's a major problem, because the one thing I have to remind my patients is hypertension is a silent killer. There's a reason why it's called a silent killer. Oftentimes, you think your blood pressures are controlled because you're not feeling anything, and the next thing you know, you end up in the emergency room with a stroke, or end up in an emergency room with a heart attack. If you don't check your blood pressure, you're not going to know there's a problem with your blood pressure until you end up in an emergency room with a problem. Or worse still, your blood pressures are going so high and you're not aware of it, it's causing heart failure and problems for your heart, and the next thing you have a sudden cardiac arrest and die from it. This is the reason why the American Heart Association has recommended that patients that have high blood pressure or diagnosed with high blood pressure have a blood pressure machine at home that they can use in monitoring their blood pressure, recognizing that we as human beings can't always tell when our blood pressure is high. Even though we think we know, we really don't know. And it's important that patients take their blood pressures at home regularly. And if the numbers are high, discuss it with your doctor on the best way to help manage those blood pressures that are high. Culturally relevant dietary advice is particularly important to overall, because if I'm talking to a Black patient and I'm telling them the sorts of foods they should eat, and I'm telling them, I want you to eat something that has to do with just salads most of the time. Some of the Black patients in my clinic may not necessarily like salads. They may prefer cooked vegetables, which are fine too. So it's important that when you're advising patients on their diet, that you ask them the sort of foods that they generally like to eat, and then you work with that kind of food, because it's very easy to abandon that particular diet because it's not you, it's not who you are, it's not what your family wants to eat. Because remember, even if the patient decides to make those changes in their habit and their family is not coming along with them, they're going to backslide. They're just not going to be able to sustain it for a long period of time. This is the reason why we send patients to dietitians, because the dietitians have time during their visits to say, okay, I'm focusing on your diet, and they can particularly focus on the patient and their culture and the foods that are relevant to them and advise them accordingly. I think that people have to think about what they like to eat overall, and they can use it to make decisions on what sort of foods that they're going to eat. Some people say, I like the crunchiness of eating something like potato chips. Rather than eating potato chips, why don't you eat low sodium nuts? That's crunchy, you get that crunch, but they're healthier. Some people may say something like, I like to eat meat. Perhaps you can make it a treat instead of making it a habit, so that you're not craving it so much because you're looking forward to eating it. So these are just some little examples that people can follow to try to eat a heart-healthy diet. It's important to lose weight, it's important to eat healthy, it's important to take your medications, it's important to do all of these. Physical activity encompasses all of the above. So if you think about it, the heart is a muscle. And if you lift weights, you build muscle lifting weights. The same way, if you engage in physical activity, you increase your heart rate, right? And you make your heart beat harder and faster. When you're doing that, you're actually strengthening your heart muscle. Your heart muscle increases blood flow to your organs when that happens. So you get very good blood flow when you're doing physical activity to your kidneys, to your liver, to your brain, to your bowels, to the rest of your organs. And guess what happens? With that inrush of blood flow to those organs actually function better during that period of time that you're exercising. The exercise or the physical activity that you're engaging in also helps you release hormones that are very beneficial to overall health. Some patients say to me, I have a lot of constipation. And I say, you know what? Guess one thing that you can do that will help your constipation? That's physical activity and exercise. So when patients exercise or move, even just plain walking, that's enough to move your bowels. So many benefits to physical activity and exercise. People think better, people sleep better, people can remember things even better. Heart rhythm problems are better solved and better sorted out. And I can tell you, even amongst my cancer patients that have heart disease, I can tell you the difference between those that exercise regularly and those that don't, because the outcome is very, very clear. Those that exercise, yes, some people say, oh, I've been exercising and yet I have a cancer. I'm like, yes, but you know what? You're going to go through treatment. The fact that you've been exercising and you're going to continue exercising through cancer therapy means that you're going to be less fatigued. You're going to end up in a hospital much less. You're going to tolerate your treatment, your cancer treatment much better. And the outcomes after cancer treatment is done is going to be much better for you because you're going to feel better afterwards. In fact, we conducted a study within the Women's Health Initiative a few years ago, and I was the lead author for that particular paper. And we showed very nicely that patients that exercise prior to diagnosis of cancer actually have less risk of heart failure, less risk of heart attacks, less risk of strokes after their cancer. So years after their cancer, because they were exercising prior to their cancer treatment, they did much better afterwards. And there have been other studies since then that have shown that those that exercise after cancer treatment also do much better afterwards as well. And there are a lot of studies, smaller studies, that have shown great benefit of physical activity for people that are exercising during their cancer therapy. And I usually tell my patients, in terms of physical activity, you don't have to run a marathon, do anything crazy. Just regular walking, daily walking is good enough to improve your physical activity, is good enough to be the recommended physical activity level that you're looking for that's beneficial to you. I mean, American Heart Association recommends 150 minutes of moderate intensity exercise like fast walking daily. And that translates into 30 minutes 5 days a week, 50 minutes 3 days a week. Very, very easily doable in terms of walking and exercise.